supposed to. Okay. So the PowerPoints don't follow along to the outline. We'll just go over the PowerPoints briefly because I want y'all to see just some of these things, and then we're going to go over the outline because I'm going to give you what you need to know. But so what is this? Just like coronary artery disease. When you think about coronary artery disease, what do you think about? What are the coronary arteries? They're the arteries that supply what?
Oxygen.
And blood to the
Heart.
Heart, exactly. So this is what you're talking about, is this plaque buildup. And it breaks off, it causes a blockage, or it becomes so occluded, you get a blockage. This is what we're talking about, having a heart attack. This is having an MI. These are some terms that y'all are going to need to know. Ischemia. What does ischemia mean? It's a condition, it's a lack of oxygen to the heart muscle. So when you hear something that is ischemic, and then you know that means the oxygen has been cut off. This is what we were talking about, angina. Just know that when you hear that, it means chest pain, pressure, discomfort. Usually it occurs when a person is diagnosed with angina. It usually occurs with exertion or exercise. So you'll see a little grandpa carrying around his little nitro pills and I'm having an angina attack because I walked too much, and so I'm going to take one and that's going to open everything up and I'm going to feel better. That's like a chronic condition. It's stable. When you have unstable, that means I'm just sitting here. I am sitting here doing nothing and I'm starting to have chest pain. That is the sign that you're going to worry about more. So there's no stress, there's no exertion, no exercise going on, but that chest pain is still happening. So does that, everybody get the difference in just regular like angina or angina, however you want to say it, and it being unstable? So if I ask you, like, what's unstable, just think, it's going to come and go whenever it pleases. And it's a warning sign because that can cause a heart attack. Cardiac output, you're going to hear that more later on, but it's exactly what it says. It's the amount of blood pumped by the heart. So if you hear cardiac output, cardiac, you know is going to mean heart. Output, it's going to be the amount of blood pumped. So just know if my heart is damaged and I have decreased cardiac output, am I pumping efficiently to my body all that it needs? No. Cardiac arrest is loss of heart function. A person in cardiac arrest, are they going to have a pulse?
No.
No. So if somebody says, I'm having a cardiac arrest, I do not have a pulse. Ischemia and myocardial infarction. What are we talking about? We're talking about a lack of oxygen and blood flow. Are you guys going to have to know every little detail and how to treat? No, just know what it is. And that's ischemia and myocardial infarction. If you hear that somebody's having an MI, a myocardial infarction, a heart attack, what do you know is happening? Blood's being cut off, and ultimately that means the oxygen supply. What's going to happen to tissues?
It'll die.
They die. Without oxygen, they die. So these are, remember we talked about your coronary arteries, this is what's happening. Ischemia can cause chest pain. If your heart isn't receiving enough oxygen, it's going to cause pain. Like it's a muscle. It's going to cause you to have pain. And that's why this is happening. And again, it talks about unstable and stable. As long as you know what it is, you'll be fine. So again, what do you need to know about that? If you're doing an EKG or a stress test on someone and they become confused or weak pulse, or they start becoming blue, blood pressure's dropping, you might think, hey, this person might be having an ischemic attack, myocardial infarction. Again, These PowerPoints will show you everything you need to know. Of course, we'll go over the outline, but signs and symptoms. There's a lot of them that are similar. So you're not going to see the same 4 symptoms that could possibly be one or the other. It's going to be pretty cut and dry. Let's see. There's just some of these I want y'all to see on here that are cardiomyopathy. What do we know about that? Myo means what? Muscle. So the heart muscle, there's something going on with it. What's happening here? It's enlarged. A lot of times, if you'll hear about women who are pregnant, they have a baby, and then they get diagnosed with cardiomyopathy. It's because it puts so much strain on the heart. It's not common, but it happens a lot. And that's what you'll see is that heart gets enlarged. Once it's enlarged, it can't pump effectively. And then again, what's going to happen? What are going to be your results from that? If your heart's not pumping, it's going one way or another. It's backing up into the lungs, backing up into the periphery, your legs, ankles, feet. Everybody okay with that?
Mm-hmm.
Cardiomyopathy? This is what it looks like. This is what's happening. This is like I said, we're not here to diagnose. We're not here to treat. We're just here to recognize the signs and symptoms. So that is going to be the key for you guys for this test, for future tests, for your certification is, do I need a diagnosis? No, but I need to recognize when something is wrong. I need to be educated so that I know maybe what's going on here or what am I going to expect. If I go in there to treat a patient and I know he has CHF, what do I expect? I expect him to be short of breath. So it's just recognizing signs and symptoms. Signs of cardiomyopathy, they look kind of alike. I mean, they're kind of just like, heart symptoms, CHF. You're going to have to just know what it is. Congestive heart failure. It's exactly what it is. The heart's not pumping right. What's going to happen to the blood?
It's going to back up.
Right. You're going to get a lot more coughing. So know that. If I say this person has like a white, frothy, like sputum cough, what are you going to think automatically? Congestive heart failure. If you ever see white, frothy sputum and congestive heart failure is one of your answers, that's your answer. Like they go hand in hand. You're not going to see that with anything else. You could, but as far as testing purposes, it's classic symptom. So this ascites. Everybody know what ascites is. You can have that with CHF. You can also see it in like liver failure, cirrhosis. It's when your abdomen is full of fluid. You'll see that a lot of people who are like in stage liver failure, or if they're alcoholics, they will have that abnormal fluid in their abdomen, which is going to cause what? Shortness of breath because it's pushing up on the lungs, right? So just know what this term means because are we studying about alcoholics? No, but ascites, that can be caused by congestive heart failure. So if you walk in a room, the person's got ascites and they're short of breath, you can't automatically assume, oh, well, they're just an alcoholic. I don't need to worry about that. Could be heart failure. Points about heart failure, signs and symptoms, liver congestion and spleen. Why? Because it's all backing up. Now, right-sided heart failure, left-sided heart failure. If you just think about only thing we've learned so far, if you have right-sided heart failure, where's it backing up to? My right side of my heart gets what? What kind of blood gets there?
Deoxygenated.
Deoxygen. Where did that come from?
From the body.
Right. So where's that blood backing up to?
To the body.
Backing up to my left heart? No. It's backing up to my body, my spleen, my liver, my feet. Now, let's talk about left-sided heart failure. What happens in my left? Where did that come from? It came from my lungs, right? So if I have left-sided congestive heart failure, do you think that can lead to right-sided?
Yes.
Yes.
Why?
Yes. Because
Because
it backflows.
it ultimately came from the right side, didn't it? Yes. So it's going to go back. Your lungs, you're going to have that frothy sputum. Are you going to have white frothy sputum with right-sided heart failure? Probably not, because it's going back to the body. It's not going back to the lungs. Left-sided, you're going to get tachycardia. We all know what that is, right? Fast heart rate. Neck vein distension. It's all going backward. Left-sided heart failure can ultimately lead to right-sided heart failure. Will you have to know the ins and outs of that? No. But if you had to choose between left or right-sided heart failure because of frothy sputum, think about the backflow. It's probably left because it's going back to the lungs. The right's going back to the body. That's why you have to think about that whole cyclical flow. Where did it come from? What's it causing? So that, here we go, regurg, backflow. Congenital defect, that we all just know that is something that's like a birth defect. It happened before birth. A lot of babies will be born with like a septal defect. That's like that the septum is what, that thick layer between the chambers of the heart. They're born with a little hole. It's a congenital defect. They can go in there and close it, but it doesn't allow blood to flow properly. So you could tell that pretty quick on a baby. Why? They're blue. They get blue. They're not pumping right. They can pretty much tell that's happening. It's pretty common. My niece had it. They fixed it at birth. She's fine. You'll see that quite a bit in the hospital. Palpitations. What's that?
The heart fluttering.
You're going to feel that. You probably feel palpitations happen all the time. If you're dehydrated, you can feel it in your chest. You probably all felt it. It feels like fluttering. It makes you want to cough sometimes. If you're dehydrated, if you're worn out, you're tired, you'll feel them more times than others. It's just the heart speeds up. It flutters a little bit, goes on. Your heart literally, and we'll talk about this later when we talk about like PVCs, like your heart beats regularly all day long, but it has irregular beats all the time. You might have 100 PVCs in a course of a day and never even know it. Because it's a muscle, it's electrical, it's beating, but you are going to have times when it's not normal. And that happens all day. Again, heart valve disease. What's the main thing you need to know about heart valve disease? What's it going to cause? What's happening?
Regurgitation.
And right, is the blood going to flow right? No.
Mhm.
Because what do the valves do? They keep the blood flowing in that right direction. So if you have heart valve disease, you have to know it's not going to be pumped right. It's going to have regurg, be backup. You're going to see all those things. It all kind of ties in together, all sounds alike, but it's gonna be more cut and dry. Like you'll know, like y'all said, oh, regurg, heart valve disease, right? Because if your heart valves aren't closing, that blood is not going where it should be. Symptoms of heart valve. Well, we've seen a bunch of these in the other ones, right? So again, you can have all of these. It could be a number of things wrong. I'm not going to give you all these symptoms that all look alike and say which one is it, because that would just be totally like subjective, because it could be any of those. You'll know the difference. Everybody know what occlude means? Occlude just means to be cut off. If you have an occlusion, it's cut off. Your artery gets occluded, it's shut down. A DVT, a blood clot forms like in the legs. What's our risk of that? What is the biggest risk of this DVT?
It gets loose and travels.
Exactly, traveling. What's a pulmonary embolism?
Blood clot in the lung.
Right, and because it probably came from somewhere else, because an embolus is that blood clot that's traveled. It's come from somewhere else. A CVA, a stroke, I'm sure everybody's heard of that. That's where part of the brain is occluded. So you've got a vessel that ruptures, or it's just blocked. That's why they'll say, is this hemorrhagic? Is it bleeding? Is it actively bleeding? That's why they want to do a head CT. They don't want to give you like a clot buster if you're bleeding. So CVA, what are you guys going to need to know about that? Well, a lot of times it's caused by a clot. And what are the signs and symptoms? Like, I know y'all have heard about a clot, but a stroke. But if you're asked, what are some of the common things you're going to see? They can't speak well, paralysis on one
Faces
side,
drooping.
right? Weakness or paralysis. Can you raise both your hands at the same time? Can you smile? You'll be able to tell. Can you swallow okay? Like, those are the things you're going to notice. What is the key in stroke treatment and management and good outcomes? The number one thing,
Diagnosing it early.
early, exactly, time, because you only have a window of time that you can do some interventions. So just know that with a stroke, if you suspect it, you need to get it diagnosed as soon as possible, and always keep track of the time. I have seen that as a question on one of these tests. It's about the timeliness in getting someone treated and diagnosed with a stroke. Not that you need to diagnose them, but if you suspect that, the number one thing you can do is get them treatment as soon as possible. Because after, that window, it's usually 3 hours, they can't do some of the things they could have done to help. Ultimately, then you have tissue death in the brain. Let's see what else. Clots. We got that. Signs of this. Your patient has a red calf. It's hot. It's swollen. What are you automatically going to think?
Blood
DVT.
clot.
Blood clot.
Blood clot. Right. DVT, blood clot. Can be dangerous. It moves the lungs. We have been over that. Pulmonary embolism. Again, you hear all these things. Oh, I don't feel very good. My lips are a little blue. I'm short of breath. I'm having chest pain. That could be a whole host of things. If the person says, I just rode the bus here for 12 hours and I have these, what are you automatically thinking? Ooh, this person might be having a pulmonary embolism. It gets missed all the time because of that. They're thinking, oh, I'm having a heart attack. No, it's the factors surrounding. Again, will you have to diagnose that? No, but it's knowing the difference, knowing what to look for. And why are those dangerous? They can cause a heart attack. They can cause an infarction or a stroke. Signs of stroke. No signs, vision changes, facial droop. They're going to be on the test. They're going to be obvious. If you're asked about, sudden severe headache, facial droop, are you going to say, oh, I think that might be a heart attack? No, you're not. High blood pressure. That's one of the things we talked about. What do we need to know? It can be caused by chronic, genetic, lifestyle factors, but it can also be caused by something else going on in your cardiovascular system. So it may just be a symptom of, kidney failure. High blood pressure can lead to kidney failure, but kidney failure can lead to high blood pressure. So it can be caused, or it can be the cause of a lot of problems. That's why they call it the silent killer. You can have no symptoms at all, right? And then we went over a lot of the different, if you're asked for, symptoms of hypertension, there's so many you can pick from. Headache is huge with high blood pressure, vision, nosebleeds, nausea. Again, without nosebleeds, you could even say, oh, these might be signs of a stroke. It's all of this is related, and you won't need to be able to diagnose something that has the same symptoms. Again, it's just knowing what is happening. That will help you answer the question. Everybody understand all of those?
Yes, ma'am.
Yes.
How does cardiomyopathy cause orthopnea and lower extremity swelling? So Farah, what is orthopnea?
Sorry?
What's orthopnea? That's okay. When you see this word or with this PNEA, that's going to tell us what? That has something to do with breathing, lungs. So if I had dyspnea, that would be difficulty breathing, right? So if I have orthopnea, Remember we talked about that in our first class? This is having trouble when I lay down. I'm having trouble breathing when I lay down. So if you lay your patient down and they have trouble breathing, or it says on their chart when you go in to do an EKG that this person has orthopnea, what are you going to think? Can I lay them down flat?
Mm-mm.
I'm going to have to sit them up some. So just know that orthopnea is trouble breathing when you're laying down. Does that make sense?
Mm-hmm.
Okay. So if it asks, how does cardiomyopathy cause orthopnea and lower extremity swelling? Why do you think that is? What's happening with cardiomyopathy? The heart's what? Is it pumping?
Enlarged is having to pump harder.
Right. It's not pumping effectively, right? So what's happening to that blood?
It's backflowing.
Right. So am I going to have trouble laying down? Yeah. Am I going to have trouble in my legs with swelling? Yes. So remember, like orthopnea, that's why we're talking about like the terms and the words, because these kind of words will help you answer the questions like later on or on your cert test. Because if you know what that means, you know what to do about it. Everybody got those? Let me see. Let's go here. So Mario, are you still with us?
Yes.
Okay, so answer this for me. Which of the questions described in chapter 4, or which of the conditions, sorry, described in chapter 4 require fast action to reduce damage? There's a ton. Pick one for me.
I'm sorry, repeat that again.
Which of the conditions described in chapter 4, I'm on the PowerPoints, require fast action to reduce damage? So if I'm thinking about all the conditions in chapter 4 that we studied, like what are some of the main ones, or give me a main one that require fast action to reduce the damage that it's going to cause?
It'd be like a blood clot.
Right? So, right. So, is that having a blood clot? Am I going to need to act fast? Yes. Because
Yes.
it can cause what? Stroke, heart attack, breathing.
Mm.
What's another one? Brianna.
If they're having a heart attack.
Yep. If they're having signs and symptoms of a heart attack, am I going to move quick because I can reduce the damage that's being done? Yes. Because if you keep that blood supply cut off long enough, what's going to happen to that tissue?
It's gonna
It's gonna
die.
die. And is it ever going to come back? No.
No.
But if you can act fast, they can get in there, open that up, and save that tissue. The reason they ask this question is just basically because I feel like all of these conditions, but am I going to be able to do something about their heart valve disease? No. That's just something that has to be taken care of by surgery, medications. But it's these acute problems that you're going to see a lot of patients with these. You're going to have patients that you go in to do an EKG on that have, problems, that have heart failure, but all of a sudden their conditions have changed and now they're having like a heart attack. So that's why we need to worry about those things, and that's why they ask this. I don't know why this question is here. How can hold on one second. Let me just. Sorry, I have a 100-pound pit bull that decides when he wants to go out, he makes all kinds of noise. So, so this question on here that says, how can EKG tech help patients receive help quickly? Well, honestly, the answer to that is just recognizing signs and symptoms and having it taken care of quickly. That's all y'all need to know, is that what is your role? Are you going to start ACLS and start pushing drugs? No, but recognizing these symptoms is the key. So just know that that's important. All right, let's go back here. Hold on, I'm going to share my. Anybody have questions on chapter 4 so far? We're going to go over this outline so that you guys will know what you need. I know somebody asked last time about like the study guide, but the reason that I have you fill out your own study guide like this is because if you have to write it down, you'll remember it. So let's go back. I'm going to just, and I'll go over it because honestly, this is where I take the test from. And so the tests come from these lectures and outlines. Let me go back over my page here. So does there, and everybody has this, correct? The coronary, this chapter 4 outline.
Yes,
So
ma'am.
what do we want to know about coronary artery disease? What, somebody tell me, if I asked you what it was, what is it? What is coronary artery disease in its basic explanation?
It's disease of the coronary artery.
That sounds like an answer I would give because literally you're exactly right. So who said that?
Me.
Okay, so you get extra credit for that answer because that was great.
Thanks.
That's shit I would say. But so, okay. So again, if I ask you about coronary artery disease, so right, coronary arteries, what do? Supply blood and oxygen to the heart. So what am I worried about? What happens in coronary artery disease? They get disease, which means they get what? They get
They have
smaller.
plaque.
Right.
I get plaque, blood
Yep.
clot.
Build up. The plaque builds up in your coronary arteries. It makes them thick. It makes them hard. Can blood flow through correctly? No.
No.
It can cause what? High blood pressure. You're having decreased heart or blood to your heart, so decreased cardiac output.
Are we supposed to be writing all this down?
You can if you wish, or you can go back and listen to it. But I'm going right on this outline, and I'm telling you that when I make this test, it will come from this information. So,
Okay.
hint.
So,
Because again, I don't want y'all to think you have to know this stuff like to be able to diagnose it. My thing is exactly that. If I say what's coronary artery disease, okay, it's a disease of the coronary arteries. I know what they are, and I know what's happening. Like, so you can then think, oh, well, I know how to answer this question. So again, coronary artery disease, build up a plaque. What else is happening? Is it always build up a plaque? Nope. They can just become hardened over time. But again, we're talking about those arteries that supply blood and oxygen to the heart muscle. So ultimately, coronary artery disease is going to cause problems with your heart, right? So it kind of cause your blood pressure to go up or down. Right. And cardiac output to your heart and body is going to be down. What is also a risk of that? What can happen to that plaque that's in those coronary arteries?
Can break off and cause a blood clot. Or
Right. And it can break off and cause a heart attack. It can travel through the heart. It can even travel through the heart and get it to the lungs, to the brain. That's the problem with plaque. Again, high cholesterol, stress, all fatty diet, high salt, all these things. But could it just be genetic? Yes. I mean, my cholesterol is perfect, and I eat more salt and fat than anybody I know. But again, it's genetic. Like, my best friend who runs 26 miles every couple of months in these marathons, crazy as all get out, high cholesterol. So again, it can be genetic. It cannot always just be what you're eating. Everybody good with coronary artery disease and what you would need to know. Ask now if you have any questions. Okay. Ischemia and MI. What is happening in this scenario? Mario, tell me what's happening. When I say MI and ischemia, just tell me what's happening. What's causing all this chaos here?
Let's see.
So do you think, what is going on? So first let's think. Ooh, so that's ischemia is what? What's the definition of ischemia?
See, it's like
Oxygen?
it's like the lack of oxygen to the heart.
Right. Ischemia and you can have ischemia anywhere, but in this instance, right, we're talking about so to the heart and MI. So again, what am I going to think? Oh, what's supplying the oxygen and blood to the heart?
The coronary artery.
Right. So again, so when I say, "Oh, Mario, like tell me about ischemia," and okay, well, obviously, what's happening? What's happening in those coronary arteries?
That's being blocked.
Right. And then what's happening to the heart muscle? Not getting enough.
Oxygen.
Right. And if I let that go too long, what's going to happen to those cells in the heart muscle?
They die.
They die, and we have a myocardial infarction. We have a heart attack. So then you can say, oh, yep. So you have ischemia that can result in death if it's not treated quickly. And that's what happens. So what is one, let's pick on somebody else now. Mari, you get picked on because you're the only male in the class. We didn't have any last time. So unfortunately, you're just going to get
All
picked
right.
on. But we'll give you some extra credit just for that. You know, I'm good about extra credit just because I feel like if you participate in class and you actually like learn something, then you deserve credit for that at least. But so how about Mary? What's going to happen? What happens with ischemia? Well, give me, if I am having chest pain, am I feeling that?
Yes.
And what's it called?
Am I?
Not necessarily. If I'm having that chest pain, that's due to ischemia. So what's ischemia? A lack of oxygen, right? So
Yes.
maybe those vessels are occluded or they're breaking. I've been out walking all day with my grandkids, having chest pain. What am I going to call that? It's okay. Don't ever be afraid to speak up in this class because I do not judge. I only want y'all to learn it. 'Cause if y'all don't pass certification, I look like a crappy teacher. So we're all kind of in this together. So if you have
Angina pectoris.
angina, right? Angina pectoris. You know, your pectoris muscle is your chest muscle or your chest. So you think about that. So ischemia is going to be caused by angina. So if I ask you, ooh, this patient's having angina when you put him on the treadmill for his stress test, what are we saying? He's having chest pain. And what is that chest pain due to? Ischemia. Why? Cutting off the oxygen supply. It's painful to the heart. That's why you're feeling that chest pain. Now, a lot of my grandparents used to carry around their little bottle of nitro. I mean, y'all, everybody heard of that before? Like they carry on their nitroglycerin, they put it under their tongue.
Mm-hmm.
It's opening. It's what that does. It'll give you a terrible headache, but it will open up the vessel. That's what it's doing. Nitroglycerin opens things up, and so it's helping with that chest pain. That's why they pop a couple and they keep going. So, Rachel, why are we worried if I'm having chest pain and I'm just sitting here? What are we calling that?
Can you say that again?
Unstable angina. So it's still angina, it's still angina, it's still having that chest pain, but it's unstable. Why? Because it's not caused by exertion or exercise, right? That's the problem. So can everyone tell me the difference in unstable and stable? Maria, I'm muting you because I don't know if you sweep in, that's what it sounds like. So can everybody tell me that? Difference in unstable and stable.
Stable is unstable is, I'm sorry, whenever you're resting and you're having the chest pains and you don't know why. And stable is when you're exercising and walking and they come on.
Which one am I more worried about? I mean, I'm
The
worried about all of them.
unstable.
Unstable.
Because that's going to lead you to your heart attack. Because that is when I'm just sitting here, my pulse rate should be low, my blood pressure should be low, and I'm having this angina attack. And patients will get diagnosed with that all the time. You will see that on their chart and in their history. Oh, I have angina. I have angina. Oh, I have a heart attack. Oh, and a lot of older people just don't get the verbiage right. But if they're popping that nitro, it means, oh. But what am I worried about is when they're popping it when they're just sitting there. Then we have a problem, because when you exercise and you exert yourself, it causes more force on those coronary arteries. So is everybody good with that? Ischemia and myocardial infarction.
Yes.
Okay. Ask now, but you won't have a chance. Congestive heart failure. Let's talk about that. Let me see who else I can pick on here. I don't have y'all all on the screen. So how about Karen?
Oh, yay.
Hey. So Karen, let's see. Congestive heart failure. First, tell me what it is. In your own words, I literally just want to know that you know what it is.
It's
And
when the heart is not pumping effectively,
right.
and it could be because it's enlarged or
It's weak.
Yeah.
When they get older, their heart just gives out. My
if they're
mother.
overweight.
Yep. You could be 112 years old, and is your heart gonna just like, it's a muscle? It literally just gives out, and if it's not beating effectively, you're gonna have congestive heart failure. And you could take Brianna's explanation and just say it's failure of the heart that causes congestion. And when I say that to myself, what does that mean? If you have congestion, what do you normally think about?
Stopped up.
Right. You think, oh, I'm congested. My chest is congested. Oh, well, if I have congestive heart failure, what am I going to be what's my main thing I'm going to be looking at? Like that whole like coughing, shortness of breath. Again, congestive heart failure can be right or left-sided. What's the key phrase I told you about left-sided heart failure?
It's shortness of breath.
What else?
Causes blood back up into the pulmonary veins.
Backflow.
What
Fluid in the lungs.
if you say nothing else, what is the one thing?
It goes back to the body.
It can
Left-sided heart failure.
also affect the right side.
It can, but what's the one thing if you see it on a test? You see
Goes
this.
to the lungs.
I'm sorry.
Goes to the lungs.
And what's gonna happen? Grandma's gonna be coughing up all kind of crap. What's she gonna cough up?
White stuff.
Sputum.
What?
The white stuff.
What did I say?
White,
Sputum.
frothy sputum. Sputum is like
Sputum.
bleh, I can, even as many years as I've nursed, sputum is just, it's that crap you cough up from your lung. It's mucus. It's like that. But white, frothy sputum, congestive heart failure. If you see those two hand in hand, they probably are not going to be specifically asking you left-sided or right-sided. But again, if you just think about it, left-sided is going back to the heart, to the lungs, right? So what are you going to see? If you see this person has white frothy sputum on, I don't care if you're taking the MCATs for your, doctor's degree, what are you thinking? Congestive
Heart failure.
Right. Those will go hand in hand. So it just causes backup. So just like we talked about, congestive heart failure, if your heart is failing, it's going to cause congestion, like congestion on the interstate, congestion in your body. It's going to back up to your lungs, to your liver, to your spleen. Grandma has congestive heart failure. What are your classic signs? Edema in her feet and legs. She gets short of breath when we walk down the driveway. She coughs up white, frothy sputum. Is her O2 sats going to be good? Probably not. Everybody got that? So what you think you're going to have, like a slower heart rate or a faster heart rate?
Slower.
Slower.
No, faster.
Mm-hmm.
It's faster.
Why? Is the heart getting
Because the heart has to work harder.
right? And it's part of that homeostasis. Your heart thinks, your body's like, oh, we're not getting enough oxygen. What do we need to do? We need to speed up our heart rate. We need to get things moving. So they're going to have a faster heart rate. The body is if you think about that too, in all of your tests, no matter what you're taking, what is your body always trying to do? Maintain balance, maintain homeostasis, right?
Homeostasis.
Right. It's always trying to do that. So if my heart isn't pumping well, everything else has to kick in because it's all going to back up. My heart, my nervous system is going to tell my heart speed up. Like everything's going to have to speed up. It's going to do all these things. If you freeze to death, what happens to your heart rate?
Slows
Slow
down.
Why? It's your body's way of conserving everything. Digestion slows down. Your heart rate, your metabolism, everything slows down. Why? It's trying to maintain a sense of balance. Your body is like, when you think about the heart and what it does, it's to me, it's fascinating. I mean, it's what you're into. Some people like race cars. I couldn't tell you even like how to turn one on. But again, it's what makes you like interested in things. And that's what's interesting about this to me, is how everything tries to compensate and how every little part of this cardiovascular system has to work in order for everything else to be right. So when we study later on about atrial fib and how the atrium, fib means fast, how if they aren't beating correctly, how can that lead to congestive heart failure? Because if it's not doing what it should and part of it's having to work harder, everything else has to compensate. Your heart is eventually going to wear out. So you do a lot of cocaine. I mean, you see that. If you have a person come in who's done a lot of cocaine in their life, they have cardiomyopathy because why? Your heart cannot maintain that constant stimulation. Cocaine gives you that rush. It increases your heart rate, increases your, activity in your body. So what's going to happen to your heart? It's going to work harder, faster and faster. And what's going to happen to it? It becomes enlarged. It's like a muscle. If you go to the gym every day and pump iron, what happens to your muscles? They get bigger. But if you do that to your heart on a regular basis, it's going to give out because it just can't, it gets bigger and it doesn't beat effectively. So you might see this 30-year-old come in and they have, cardiomyopathy, congestive heart failure. And you're like, God, what's wrong with him? Oh, well, wait a minute. Got some white powder on his nose. Well, let me think he might be might be a drug abuser. Maybe that's what's going on here. Like, you can kind of start to see how everything kind of just affects the overall, So everybody good with congestive heart failure?
Mm-hmm.
What do I want to know about right-sided heart failure? What's going to back up to my veins that carry oxygen to the heart, or deoxygenated blood to the heart? So the first thing I'm going to see is liver, spleen, edema in my feet and legs. Left-sided, it's going to go to my lungs. It can eventually cause right. So if you see that on a test, as long as you know the difference, you'll be fine. Heart valve disease. Who wants to tell me about that?
The valve helps the blood to flow in the right direction. So
If I have heart valve disease, what's going to happen?
it's not going to go in the right direction. It's going to backflow.
Which is
And,
called what? It's called what, Sarah?
Regurgitation.
Regurgitation. So right. So then what else is going to happen?
So it's going to go back. The blood is going to backflow to the body, and
Right.
the congestive heart failure.
Right. It's going to backflow to my lungs and my body, depending on which valve is messed up. But with valve disease, right. What you need to know, backflow, regurgitation, right. Because what do I need to know about the valves? Exactly what you said, right? They cause the blood to flow in the right direction in the right amount. They close and they open. So am I going to see increased heart rate?
Yes.
Yep.
Right. Why? Where's that blood going? Back to my lungs, which is cutting off my oxygen supply, right? So my body's going to be like, oh, we better speed up this heart, get it moving. So will you see that? Yes. Think you'll have chest pain?
Mm-hmm.
Sure. Cough?
Yep.
Yes. Okay. Let's see. Blood clots. I put CDA. It's not on your sheet. I don't know how this is not on here, but I'm sticking this under here because when you see this, this is a product of that. So for blood clots and complications, what do y'all think you need to know about that? Let's see, who else can we pick on today? How about Charity? We haven't heard from you today. Because I only have like 4 up on my screen here. Let's see, I'm gonna unmute you. There you are. Uh-oh. So Charity, are you there? Yeah. So tell me about blood clots. Why does blood clot? What happened?
In the location.
I think we have a bad. Can everybody hear her? Okay, because I don't. It's like a.
I
Oh,
don't hear either.
Can you turn your volume up? You just might have a bad connection too. Oh, kitty. So Charity, can you hear me? Okay. It's just frozen.
Her screen's frozen.
Yeah, that's okay.
I can hear you.
You can hear me? Maria. Let's pick on Maria real quick.
Yes.
Maria, so tell me about blood clots.
Blood clots.
Yeah, how do they normally
usually
form? How do they normally form?
without
Why do they form? Why does the blood clot form?
I don't know, lack of movement.
Well, right. If blood pools, it does what? It clots. You may have a disease that disposes you to blood clot. So that can happen, right? So why am I concerned about blood clots? Tell me what the main problem is.
Because if you do not find them quickly, it can result in death.
Why? What causes death from a blood clot? If I have a blood clot in my leg, why might I die?
Because you get a thrombosis.
Right, but what happened? That's a blood clot, right? But what's going to happen? What is your blood constantly doing? Moving. If I get a blood clot, what am I worried about?
Blood flow.
The flow.
Oxygen.
Am I worried about the clot breaking off and
Moving.
traveling?
Go into your lungs.
Right, and my heart?
Yeah.
Or my brain? Right. So that's what I'm worried about, really. I'm worried about the embolus, right? That part that can move. I mean, if you leave a blood clot long enough, yeah, it's going to cut off circulation to that part of your body. But my main worry is that blood clot is going to break off and move, right? So then what is, if I say this person has CBA, could that have been a blood clot? Yeah. Traveled where? Where did that blood clot break off and travel to?
Your brain.
Where? Brain. What's a CBA? Y'all know what that stands for?
A stroke.
Stroke.
Right, but what does CBA stand for?
Cardiovascular attack.
Accident.
Cerebral vascular accident. So cerebral means what? Your brain, your head. Vascular accident. So something happened in the vessels in my brain. A clot broke off and went there. It busted, and now it's bleeding out in my brain, or it plugged it up, right? If it's plugged up, they can give me some medicine to bust up the clot, but they need to act fast, right? So what's the main thing I want you to know about the treatment of a cerebral vascular accident?
Act fast.
The
Know the
time.
symptoms, act fast.
The time to diagnosis and treatment. So let's all just throw out there some signs and symptoms of a CVA. If I think my mother is having a stroke, why might I think that?
Her face is
Difficulties.
Droopy face?
Fusion.
Yeah.
How about she can't swallow? If I take a drink and it comes back out, what's that?
Vision.
Blurry vision, severe
Headache.
Mhm. Dizziness. What about altered mental status or, changes in my mental status? Will we see that?
Mm-hmm.
Mm-hmm. So, know your signs and symptoms of a stroke. So, hypertension. Let's talk about that. How about, like, Jess, you tell us about hypertension.
Hypertension is high blood pressure.
Yep.
Um,
And what? Give me some
It's
reasons.
chronic.
Mm-hmm.
Comes from smoking or obesity, stress, heredity. Being African American
Mm-hmm.
can cause it to be more likely.
Can it always have to do with heart? Can
No.
it be caused from something else? Right. So I could have hypertension because of some other reason, right? What am I going to worry about if I have untreated hypertension?
Heart
What
failure.
Right? What else can it lead to?
Kidney damage.
Yes. What else?
Stroke.
Stroke. Yep. What can I do about hypertension? Is there anything I can do? If it's genetic, can I do a lot? No, I can take some medications to try to keep it down. But what else can I do? If it's lifestyle, what are some things I can do besides stop smoking?
Change your
Mostly
diet.
Your diet.
Mm-hmm.
No
Diet,
salt diet.
lifestyle, drug abuse. I can keep it.
monitor it.
Right. It's all those things I can do. Do you think hypertension can lead to cardiomyopathy? Why is that? What's cardiomyopathy? It's that enlarged muscle layer of the heart.
Heart muscle.
So do you think hypertension can lead to that? Sure.
yes.
That's one of the things you look for is this man who's had hypertension his whole life and it's just gotten worse. He's 50 years old. He's overweight. He's got this, when I do a ultrasound, what am I looking for? I'm probably going to have an enlarged heart. Then what am I worried about? Is he going to have good circulation? No. This man might be obese. His ankles and feet might be swollen. They might have, shortness of breath. You see all these things that are related. And why? Because of just chronic hypertension. It just leads to this whole host of other problems. Again, why do we want you to know this? It's because it's just making you think about what's going on. Because if your heart isn't pumping effectively, everything else is not working effectively. Does that make sense?
Yes.
So does everybody know the signs and symptoms of a heart attack and a stroke and what you would see with cardiomyopathy? What makes these all different? Anybody have questions about these at all? No.
No.
Y'all should all make 100 on the test. All right, now let me see. Did y'all get, okay, I want to just ask if this made sense. Did y'all get these? Let me see, heart cycle on. Let me pull this up. Did you guys, I don't know if you can see my screen yet. I sent these by email. Did y'all get these from me?
No.
No.
Y'all
No.
get these? Oh, I sent them. Okay. Well, I sent these
No.
to you guys. I wanted you to start putting it together because here's my crazy handwriting and drawing. And if we were in class, you would laugh at my ridiculousness because I cannot draw, nor can I even write good. But I wanted you to be able to put it all together. If we go back to chapter 3, let's go back to chapter 3 and start thinking about blood flow. and you see this, like when you think about doing an EKG, you think about this. Is everybody, let me just go back here. Does everybody, let's see. Let's see. Can everybody see that, the blank one?
No.
No.
No. Yes.
Yes, it's
Yes.
just, I think it's lag. It just lags a minute. In case I put up something inappropriate, maybe that's what they're thinking, but trust me. So okay, so everybody sees this, right? When you think about EKG, you're thinking about, oh, I'm gonna run this strip. This is one heart cycle. It's one heartbeat. I want to tie that in for you so it starts to make sense, because why do we need to know about blood flow? Why do we need, this is what's happening. When we talk about blood flow, when we talk about a heartbeat, a heart cycle, this is one heartbeat or one heart cycle on an EKG. This is what's happening. So that's why we need to know about that. So again, let's see. Y'all should be able to see this. So this is, does everybody see this with the crazy blue writing?
Mm-hmm.
So the reason I sent you all these, I think 5 of these. So when you think about the heart and the blood flow, this is what's happening. So if you think about it in terms of, I'm visual. Some of you might not be, and this may be irrelevant, but again, every different way you can look at it helps you to put it all together when it gets time to do that. So if we're talking about blood flow, let's just start right here. This is what's happening when the blood is returning to the heart from the inferior and superior vena cava. So we all know it's deoxygenated, right? It's blue, doesn't have any oxygen, which I should have done, but I didn't. So it's blue. I probably should have color coded all the way through. But if you just look at this, we're not going to learn this right now or how to count it, but in this heart cycle, this is what's happening right here. This blood is returning to the heart. And where does it go to?
The right atrium.
The right atrium. So right, this blood is coming here, and if I want to visualize this, this blood is coming here to the right atrium. Okay, this is what's happening.
So that hump is the right atrium?
Well, kind of. That's when it's contracting, because this is one heart cycle. But when you do an EKG, if you're an EKG tech, you go in to do an EKG. What are you doing? When you're measuring an EKG, you're measuring the electrical activity of the heart. The electrical activity is telling you what's happening mechanically. So when you put those electrodes on, it's picking up this electrical activity. If I put a big pole on my roof and put a thing there, it would pick up electrical activity in a lightning storm. That is all we're doing, but it's telling us what's happening here. So I put this here so that you understand that the blood flow and why we're learning it is because this is what's happening. The blood is being returned to the heart. So we see that. Okay, well that's cool. That's good. Okay, let's move on. All right, let me pull this one up. Y'all should be able to see this one. It's in green. Y'all see that? Y'all see that now? So the one before, what was happening here? The blood was being returned to the heart, right? Again, we're talking about electrical activity. What's happening in your heart? Electrical and mechanical. Right now, what are we studying about blood flow? It goes in one direction. It has to move through the heart to get blood and oxygen to everything else. So here, that blood, and you're not going to have to know this for the test. This is an example so that you understand blood flow and why it has to move correctly and what's happening. So this blood goes where? Into the right atrium and the right ventricle, right? And it's being pumped, right? What's got to happen? That right atrium and right ventricle have to pump that blood. It has to keep moving with a force to move that blood through. That's what's happening here. That blood is then traveling through the right atrium, and we know it goes where? To the lungs after that, right? So it goes to the right atrium, right ventricle, it goes to the lungs, right? And then it comes out of the lungs, and goes to what? The left
Ventricle.
left atrium
Atrium.
and the left
Atrium.
ventricle. Okay, so let's remember that, right? Okay, so we know that the left ventricle, oh God, where'd my mouse go? Is the powerhouse, right? Oh God, well, so we know what's the powerhouse chamber of that heart?
The left side.
Left ventricle,
Left ventricle.
right? So this is what's happening. That blood then goes from the lungs. Y'all should be able to see this. You see the screen with the red writing?
Yes.
So
Yes.
so what happened? So it came in, it got pumped through the right atrium, right ventricle, went to the lungs. It comes back in the left atrium, left ventricle. Look how big this heartbeat. This is the pumping of the right atrium. Look at this. This is the pumping of the left. So that's what's happening, right? This left ventricle then has to push all that blood with all of its oxygen from the lungs out to the aorta, to the coronary arteries, and to the body. And that's what's happening right here. So electrically, this is what it looks like. But we know what's happening, right? That's why it's important to know your flow, because these things all change. What's going to happen? Your blood isn't flowing correctly. Something is not right. I just showed you this because I want you to see that this is flow wise, this is what's happening. So the ventricle then pumps that thing out, and then let's see what happens next. Can y'all see the screen with the black writing yet?
Yes.
Yes. So after this ventricle pumps all that blood, it's got to recover, right? It's got to relax for a minute. Do you see relax of the atrium? You don't see that because this ventricle is so powerful. Do we need to know that right this minute? No. We're going to figure that out later. But this is my whole point of this with the blood flow. The ventricles relax. It all goes to the body, to the aorta. It all comes back. And guess what happens? It all starts right back over.
So the second little hump, that was where it goes through the aorta
Right
and
here.
out to the body.
Here. This is where all that takes place. It's so big. This actually is called a T wave, which we'll worry about that in a couple of chapters. But this is recovery. This is basically like this space, and this is kind of like the left ventricle. It's all recovered. It has to recover. It contracts and relaxes. You don't see it from the atrium because this ventricle is so powerful. It takes over. But you see this. Now, when you have a heart attack, when a person is not perfusing to their coronary arteries, how are we going to tell that? Much later on. But again, in the flow, it's going to happen right here. You're going to have ST depression or elevation, ischemia versus injury. We'll learn about that later. But again, if you're thinking about blood flow, which is what we're thinking about right now, this is what's happening. Inferior and superior vena cava dump into the right atrium. It gets pumped into the lungs and then into the left atrium and left ventricle, where it gets pumped right here with all this force to the body, to the aorta, and then to the coronary arteries, and then the left ventricle takes a break, and it all starts back over again. That is what you're hearing. Your valves are closing. The valves are closing. They're closing. Like this all has to happen for it to go. This is what you're hearing in the heartbeat. What you're actually hearing with the stethoscope is the valves closing. Boom, 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 boom. You're hearing the right and the left doing what they're supposed to do. This is the cycle of the blood flow. Inferior and superior vena cava, right atrium, right ventricle, pulmonary artery goes to the lungs, gets oxygen, comes back to the right atrium. No, sorry, left atrium,
Left.
left ventricle. You got this big powerful beat out to the aorta, coronary arteries, and then it starts all over. That's why when it's fast, you see it like you might see 3 of those beats in one if your heart's beating really fast. This is just a normal heartbeat. But I show you this because I'm trying to it's another way of looking at the blood flow. That's what's happening. Flowing through the heart. The heart's got to beat it somewhere. That's all. Is everybody good with that? With the blood flow?
Mm-hmm.
Okay. Oh, I think I put it here too. Oh yeah. Y'all have my nice writing here. Because again, the blood flow is going to be important. Does everybody see that with the crazy purple writing everywhere? But it's just what we just talked about. Inferior and superior vena cava, right atrium, ventricle, left ventricle, aorta, coronary arteries, and then left ventricle relaxes. As long as you know this blood flow, you won't have any problems. Anybody have questions about that?
So we don't have to know like the valves, like it goes into the tricuspid valve and then the pulmonary valve and
Yes, but
mitral.
you know those. Yeah, you will have to know those. Let's see. I will show you. Hold on. This is a good one. We have to ignore part of it. Let's see. Can everybody see that? It's the part that's labeled.
Mm-hmm.
I don't like that, but let me see if I can find you a different one because that one's got more stuff than you need to know right now on it. Hold on. But again, if I asked you what's okay, so right atrium and right ventricle, where's the blood going from that?
From the tricuspid valve.
To
It has to go
that
through it.
separates the two, and then where does it go? Where's the blood go
The
from there?
pulmonary.
Right, because it's going to the lung.
Pulmonary.
Think pulmonary means what? Lungs, right? So then if you think, oh, well, okay, just by series of deduction, the aortic valve is where?
It's the last one.
Well, it's the base of the aorta, right? From the left ventricle.
Mm-hmm.
What's the valve between the right and left ventricle?
Mitral
The
valve.
mitral.
The mitral valve or the bicuspid valve, right? So this is, can everybody see this? It's the heart with the blank labels.
Mm-hmm.
Yeah.
If you had this on the test, could you label it? So if you look at this just from where you're sitting, like just if I'm looking at this heart, this is what chamber here?
Right atrium.
And this is what chamber here?
Right ventricle.
So I know there's a valve here. What valve is that?
Tricuspid.
Tricuspid.
And then I know the blood gets pumped up here. And where am I going from here?
To the lungs.
So what valve
Pulmonary.
is this?
Lungs.
Pulmonary.
And then I know it comes back and it goes and it comes here to which chamber is this?
Left atrium.
And which chamber is this?
Left
Right
ventricle.
Ventricle.
Left what ventricle?
Left ventricle.
And then it goes where?
To the
To
aorta.
the aorta.
So what valve is this?
Aortic valve.
So does everybody got those? Those should be, I mean, tri comes before bi, which we know this one's going to come first. Pulmonary always means lungs. Aortic, well, we know that where that's going. So again, that should be easy for you guys to remember or put together. Bicuspid valve, mitral valve, you might hear that. Mitral valve, we just know. You're going to hear mitral valve prolapse and mitral valve regurgitation more than anything else when you hear about valve problems. So what am I going to think? Mitral valve, I know that's between what? The right and left ventricle. That's going to cause some problems. If I have mitral valve disease, where's that backing up to first?
The lungs.
Am I going to have shortness of breath? Of course. What is this structure? Can y'all see my mouth?
Superior vena cava.
And what's this one?
Inferior vena cava.
What is this?
Aorta.
Yep. What's this?
Coronary.
Aorta. The aorta still.
Yeah, look how huge that is. And it's going where? To the upper
Body.
body, the coronary arteries, and lower body. What's this?
Pulmonary artery.
Yes.
Vein.
Comes back, right? This is the pulmonary artery. When it comes back from the lungs and goes to the right ventricle, what is that called? The pulmonary what?
Pulmonary vein.
Right.
Vein.
It's the only time you're going to see the veins have oxygenated blood and the arteries have deoxygenated blood. Normally, it's the opposite, right? Because this inferior and superior vena cava have what kind of blood?
Deoxygenated.
Deoxygenated.
Right. Everybody understand the flow of this blood. If I say start here and label it, you should be able to label that. I don't think y'all have any problems with that. Everybody
Why?
I'm sorry, go ahead.
I said, why mitral valve gets more disease than other valves?
I think if you think about the heart, who does the most work is the left ventricle, right? So it's always got a lot of pressure. This is just my own educated guess, but think about it, it's always got a lot of pressure on it, because where do you get the bulk of your pump for that heart? What's working the hardest? That left ventricle. So that blood that's coming from the heart, it's rich. It's getting pumped out. It's got to be there's a lot of force there that gets that blood from the lungs to the left ventricle, by way of the right ventricle. So that mitral valve I see it. You see it a lot. It wears out a lot, and it causes a lot of issues. I think it's just the pressure. If you think about the pressure that's on those valves being pumped versus up, it's just coming back. It's not a lot of pressure because it's kind of a ripple effect. When your heart is beating, the bulk of that comes from where? Your left ventricle.
Aortic, it doesn't have that much pressure.
I'm sorry?
Aortic valve.
It does get a lot of pressure, but I mean, at that point, it's there. It's probably stronger. I mean, you figure the aortic valve is sitting just at the base of the aorta, where the mitral valve is literally between the two. So you're talking about a smaller space. It does wear out quicker. I mean, you have valve disease, but you have a lot more. You hear about mitral, because I think when mitral valves start to leak, you start to see problems pretty quickly because it backs up. It's so closely related to the lung. So I think that's a lot of your issue. They replace it with a mechanical valve. They can use a pig valve. They can, they've come a long way with valve replacement, because after time they just wear out. It's anything else that just gets used, and there's a lot of force. By the time you get back here, the force of that blood, there's not too much going on, because you figure one heartbeat is just the heart contracting to send that blood. It's got to contract pretty hard. By the time it comes back to get dumped into the right and left atrium, to the right atrium and right ventricle, not a lot of force there. So you don't hear as much about the tricuspid valve having problems. But you got to get out through the lungs and out to the body. There's a lot of force. Everybody get this system, how you have a pulmonary circuit and a systemic circuit. One supplying blood to the lungs, one supplying blood to the body. Everybody get that flow of this?
Yeah.
Everybody good with that?
Yeah.
Uh-oh, hold on. Share this. Well, good. All right, let's we'll take 10 minutes. We'll take a 15 minute break. We'll come back at 7:45, 7:50. And then we'll have some random questions about 3 and 4 straight from some old tests, and then we'll go over anything else y'all need to know about 3 and 4 for the test on Thursday.
Okay.
All right, so we'll just come back at like 7:50. Y'all good with that?
Yes, ma'am.
All righty. We'll see y'all in a minute. I wonder if we can just